Hello everyone. Today we'll be studying about multiple sclerosis. So, contents of this video will be basically first we'll be reading what is MS, followed by its pathophysiology and risk factors, followed by its clinical features and presentation, subtypes, workup, and we'll be finishing the lecture with treatment. So, first of all, we'll start with what is multiple sclerosis. So, what is multiple sclerosis? It is a chronic inflammatory demyelinating disorder of CNS. Okay, so it is associated with demyelination of neurons of the CNS. So we all know CNS mean neurons are myelinated by oligodendrocytes. So we know in MS there has something to do with that myelination that is being taken care by oligodendrocytes. So it is an autoimmune disease. It is believed to be autoimmune disease actually. ठीक है, it affects females more than males. ठीक है, usually 20 to 40 years old. So, and important is it does not involve peripheral nerves and organs. ठीक है, so there is no involvement of peripheral nerves and organs. It is associated demyelination of cortex, subcortex, brainstem, and spinal cord only. Okay, so we all know in a neuron there is myelin sheath. Okay, then there are spaces between myelin sheath that are known as node of Ranvier. There is saltatory conduction, means the impulse is conducted from one node of Ranvier to another, therefore increasing the speed. So whenever there is demyelination, this saltatory conduction is lost. The speed with which the a signal is transmitted is decreased. So talking about risk factors, okay, first of all, female gender, as you know this is a autoimmune disorder. Okay, then one important is vitamin D deficiency. Okay, that's why this is more common in North Canada and everywhere, not in India, because India actually receive a considerably good amount of sunlight. Okay, so this followed by high socioeconomic strata. Okay, so high socioeconomic status. There is EBV infection. Okay, and there is family history involvement. ठीक है, उसमें भी there is HLA-DR2/15. ठीक है, so pathophysiology, the first step is, ठीक है, there is damage to the blood brain barrier. ठीक है, so blood brain barrier is damaged. ठीक है, so therefore it becomes permeable. ठीक है, permeable to B cell and T cells. We all know blood-brain barrier is formed by foot process of astrocytes as well as the endothelial cells of the blood vessels. ठीक है, so when this is lost, cell movement can occur. ठीक है, so damage is mainly by two. ठीक है, one is T cell mediated damage and there is B cell mediated damage also. ठीक है, T cell target MBP, that is myelin basic protein. ठीक है, B cell is associated with damage to myelin oligodendrocyte glycoprotein. ठीक है, so this is myelin oligodendrocyte glycoprotein MOG. ठीक है, so both of these are leads to decrease in saltatory conduction. ठीक है, so you know when there is damage, the repair process also has to start. So when there is repair process start after damage, ठीक है, the repair process starts. Repair process CNS में कैसे होता है? That is gliosis. That gliosis is the thing that you see in MRI as Dawson fingers or paraventricular collections. Okay, so this is all about this. ठीक है, Dawson finger also I'll explain. Actually corpus callosum से perpendicular projection are known as Dawson fingers. ठीक है, the other MRI finding is paraventricular. Around the ventricular there is white collection. This is just a basic diagram I have drawn. ठीक है, coming up to the clinical features, the most common clinical feature are sensory. ठीक है. There can be pain, there can be pins and needle sensation, ठीक है. There can be allodynia, ठीक है. The second most common involvement is optic neuritis. This optic neuritis is unilateral, ठीक है, asymmetrical. If at all it involves bilateral, it is drug responsive, ठीक है. It is painful, it is associated with retrobulbar pain, ठीक है. And there is no red eye, ठीक है. If the same features are seen with the red eye, that points towards sarcoidosis. And you know, there is a point, sarcoidosis is also a chronic inflammatory disease. Okay, then third is motor involvement, and there is a special thing about the motor involvement. We all know it can cause demyelination of cortex, subcortex, brainstem as well as spinal cord. So wherever it will cause demyelination, उसी जगह का it will cause symptoms, ठीक है. मोटर, इट कैन प्रेजेंट एज बोथ अपर मोटर न्यूरॉन प्लस लोअर मोटर न्यूरॉन लीजन, एंड दिस इज अ स्पेशल फीचर ऑफ टू डिसीज. One is multiple sclerosis that we are discussing, other is amyotrophic lateral sclerosis. Okay, ठीक है. You know upper motor neuron diseases, that is increase reflexes, Babinski etc. Lower motor neurons is actually flaccidity and loss of reflexes. Other special presentation, just to remember, bilateral intranuclear ophthalmoplegia that occurs due to medial longitudinal fascicular involvement, bilateral trigeminal neuralgia, and acquired pendular nystagmus. 3 points to remember. Important is McDonald criteria. It should be DIT plus DIS. Okay, what is DIT plus DIS? Is disseminated in time, ठीक है. That is, the symptoms must be disseminated in time. Therefore, there should be more than equal to 2 symptoms. Staying for more than 24 hours. Taken gap between 2 symptoms is more than equal to 4 weeks. Okay, this lesion can be clinical or radiological. And disseminated space means 2 spaces like spinal cord plus subcortex or spinal cord plus brainstem. Okay, this is disseminated in space. When both these criteria should be met in order for a clinician to label a patient as a patient of multiple sclerosis. There are some ancillary symptoms also. One is Uthoff phenomena. Uthoff phenomena is there is increased symptoms or worsening of symptoms on pouring hot water. ठीक है, तो basically a patient in complaint put some hot water on his head and have a unilateral diplopia. Pouring hot water, and is a temporary phenomena. In this case, no steroids are to be given. Lermite sign, ठीक है. On flexing the neck, there is a sharp flexing the neck. There is a sharp radicular pain. ठीक है. This is actually seen in cervical. There is also seen in compressive myelopathies and tibius dorsalis as well. Then there is Pulfrich phenomenon. Pulfrich phenomena is altered visual perception. Altered visual perception, a 2D image is being perceived as 3D. There exists a 2D, you are seeing it as a 3D image. Workup, gadolinium enhanced MRI. ठीक है. On T1 weighted image, if you will see, you'll see contrast enhancement. Okay, and T2 weighted imaging में you will see hyper intensity. That I have already explained, that when we call it Dawson fingers and when there is paraventricular also. CSF में one, there is increased proteins, that is increased IgG, ठीक है. And there is you have oligoclonal bands. Oligoclonal bands are that you are seen in electrophoresis of CSF. ठीक है. Visually evoked response में you see increase latency. ठीक है. Treatment acute attacks versus prevention. Acute attack में drug of choice is the one drug, that is steroids. If steroids don't work, you can do plasma pheresis as well. ठीक है. Steroids are also used in relapse and remission. Prevention. Infusible drugs are natalizumab and ocrelizumab. ठीक है, एंड इंजेक्टेबल इज ग्लैटिरामर एसिडेट. ओरल में यू हैव फिंगोलिमोड एंड टेरिफ्लुनोमाइड. नाउ वन थिंग लेफ्ट टू डिस्कस दैट आई हैव नॉट मेंशन्ड इज सब टाइप्स ऑफ द डिसीज. ठीक है, दे बेसिकली 3 सब टाइप्स, classical subtypes. One is relapsing remitting. Relapsing remitting is the most common one. ठीक है, you'll have a symptom, after a few days you'll have a symptom relief. This is relapsing and remitting. This is most common type. Then there is secondary progressive. Secondary progressive में one episode, another episode and third episode के बाद it just increased. ठीक है, third is primary progressive. Primary progressive is least common. ठीक है, but it is worst. पहली बार symptom आया and it will keep on increasing. Only one useful drug, that is anti-CD20, that is ocrelizumab, seems to work. ठीक है, so what is basically multiple sclerosis? Autoimmune demyelinating disorder of CNS, can involve cortex, subcortex, midbrain, the brain, that is brainstem, that is midbrain and peripheral hindbrain and spinal cord. जहाँ पे भी it will affect demyelination होगा वहीं का symptom आएगा. You can have sensory symptom, you can have nocturnal neuritis, you can have motor, both upper motor neuron, lower motor neuron. Other symptoms can be there like sensory ataxia. Diagnosis में you'll do MRI, you'll see lesions disseminated in space. Disseminated time is basically symptoms. More than 2 symptoms staying for more than 24 hours, 4 weeks apart. ठीक है, ट्रीटमेंट में यू हैव एक्यूट अटैक में द ड्रग ऑफ चॉइस हैज़ टू बी स्टेरॉइड्स. इफ इट डजंट वर्क, प्लाज्माफेरेसिस कैन बी ट्राइड. ठीक है, and female more common than male. Autoimmune disorder, T cell plus B cell mediated damage. You have gliosis, you have Dawson fingers, you have oligonucleotide bands and everything. So thank you so much for listening so much patiently to me.